Good evening, everybody. My name is Simon Ramshaw. I'm Managing Director of Erchonia Lasers Limited. We're based in the UK, but we represent Europe, the Middle East, and Africa for US company, Erchonia Corporation. Welcome to our webinar tonight on the scientific underpinning of non-thermal lasers, part 2. About 10 days ago, Dr. Rob Sullivan did part 1, so welcome back for the second presentation. I think when Julie sent the invites out to everybody, she included a link to part 1. So obviously watch that in your own time. As you see, I've got the laser on me actually now. I had a workout before and I appear to have done something to my neck and shoulder. So I'm lasering myself every few minutes at the minute. This is the mainstay of what we want to try to get across from this educational webinar. When we first launched the lasers for Erchonia into Europe and various different events, one of the things we noticed was a lot didn't seem to understand what laser was. A lot of people, clinicians, thought they had a laser, but it wasn't. It was either LED or it was infrared, and they're completely different energy mechanisms, delivery mechanisms. So Dr. Rob Sullivan's been using non-thermal low-level lasers in his clinic in Ireland since 2012. And the clinic pretty much runs itself. Rob's a reconstructive orthopedic podiatrist by trade, but he's very much renowned for thinking outside the box, looking at various other areas where he can expand his scope of practice, as well as sort of giving his patients the best treatment possible. So Rob's been responsible for doing various different level 1 placebo-controlled studies. His most recent was pre-diabetes in obesity management. He's also been responsible for doing a study on diabetic peripheral neuropathy. And he's done various different fungal nail studies with our lunar laser as well. So before I introduce you, you will notice down the right-hand side, there is a menu and you will see questions. So by all means, put your questions down there. Both Julie and myself and Dr. Rob will be checking it as we're going along. Most will probably keep to the end, but if there is something that needs to be discussed before, then I will divert that question to Dr. Rob. So Rob, as always, we're always proud to have you on here. You're a big advocate of non-thermal low-level laser. And I know a lot of the research and the education that you provide is very much appreciated, not just by us, but by practitioners all over Europe and the Middle East when you go to lecture over there. So welcome, and over to you.
Thank you, Simon. As you guys can see, at the moment, I have very nice lighting and things like that because we have a power cut at the moment. So I'm basically running on batteries and everything else. So normally when I talk to you, I leave the camera on. To conserve the battery on the Mac, I'm going to turn it off for this and turn it on again at the end. So what we're going to do today is pretty much talk about the second part of the scientific underpinning of non-thermal laser. So what I want to do is just a very brief recap. So last week we talked about, or 10 days ago, we talked about the principles of photobiomodulation, and we discussed the various aspects of that. We talked about non-ionizing light, etc., and how that applies to the body. And I also said that I felt personally that this particular type of laser that I use, which is true non-thermal low-level laser, doesn't really fit into that photobiomodulation spectrum. We then had a look at what we thought we knew about the body and lasers. We went then to look at why would it be a non-thermal laser? Why would we not use something that's high energy and all singing on, all dancing in the advertising? And then we basically looked at the whole concept of beauty is a big thing at the moment. Everybody wants to look 10 years younger. Everybody wants to look 10 kilos thinner. Well, most people do. and everybody is concerned with beauty on the outside. So we took a look at beauty on the inside, which led us down the road of what happens when we age and how that affects our body, how that affects healing, and how non-thermal low-level lasers really play into that particular spectrum. So today what we're going to do is we're going to have a little bit of a discussion around the overview of medical lights and what kind of lights we use. Then I'm going to go through some case studies. Then we're going to look at everything in terms of it's not just muscle and bone when it comes to these lasers, it's brain as well as other, I suppose, soft tissues, soft organs. Then we're going to have a look at some of the case studies based in research and some of the stuff that I think is really exciting about non-thermal laser, and something that will also show you the potential of these. And then we'll look at conclusions, and I always like you guys to draw your own conclusions. So there are going to be some videos during this. I'm not going to make the videos full screen. I leave them as small as they are, but you will be able to see and hear them quite well. So thermal laser is what we're going to talk about first, and thermal laser isn't really any different to non-thermal laser insofar as it's columnated, it's coherent, it's a unidirectional beam, and it's in phase in frequency. Thermal lasers differ from non-thermal lasers insofar as a thermal laser has a target, and we'll see that shortly in one of the videos when we see a thermal laser working in terms of the target that it has. Non-thermal low-level lasers, as far as I use them, they don't have a target, so there is no thermicity. Thermicity always occurs, or heat always occurs, at the point of that laser inception or target within the tissue. So thermal lasers are used because they can and will damage the surrounding tissue, and as a surgeon that's what I sometimes want them to do, because I want that tissue to stop bleeding, or I want that tissue out of the way, so rather than cut it off and throw it in the bin, we just vaporize that tissue. So these lasers will to a certain extent leave an amount of scarring because the tissue formation is slightly different as a result of that thermicity. And if we use some of the class 4 lasers in a certain way, we do heat the skin, and it does feel quite hot, and it does cause pain for the patient. So as I've already said, thermal lasers are often used in surgery. We use them for cutting, we use them for coagulation, we use them for control target work and stuff like that, and we use them for a collection of other things. So for over 20 years, lasers have been used in lots of areas, as we spoke about last time, and as we will talk about later. And they've pretty much proved to be safe with very few associated issues. That's when we talk about thermals. With the non-thermals, of course, there aren't any recorded issues at the moment. So anecdotally, at the moment, there is some research floating around which is linking some forms of thermal laser to certain cancers in evidence, but that is still being worked on. The citation is there at the bottom. You're quite welcome to go look at that when Julie sends you out the information tomorrow. So what kind of thermal lasers do we have? We have something which is called laser coagulation, which basically starts around 60 degrees, and it's the type of laser that we use to coagulate tissue. It's very much used for sealing blood vessels, stopping minor bleeding of small telangiectasic veins and tissue like that. The other sort of lasers we have then are vaporization lasers, and these can get up to a temperature of around 300 degrees, and they effectively evaporate tissue, and they're effectively used in surgery for cutting soft tissue. Where they're used extensively is when it comes to prostate problems in men and certain vaginal issues in women. So let's just have a look at this, and it will explain a little bit more about it. So this is your vaporization laser. So as you can see from that, that's a vaporization process. It's a green laser, and it's basically inserted into the male penis, and it's used to basically reduce the amount of pressure caused by the prostrate onto the urethra. So again, it's something where it's a day procedure. It's very quick, and it's pretty much changed a lot of the way that surgery is done. The other kind of lasers that we can look at would be thermal lasers, and these are ablation lasers. Let me just stop that again. So they're pretty much ablation lasers. They're used in urology a lot. They're used in eye surgeries a lot. They're very efficient. They're also used for kidney stones and things like that. So this video is going to look at those and how they have affected us, and this was a newscast in the States recently.
New at 6, more than 50 million people worldwide have epilepsy. For some, medication controls the onset of seizures, but others need major surgery. Sometimes laser ablation is the solution, but there have been no guidelines for doctors to determine how much ablation is just enough to be effective. Now, Ursula Perry reports neurosurgeons are getting closer to having the answers.
Todd Garrick is an avid cyclist, but a recent epileptic seizure knocked him off his bike and onto a busy roadway.
I happened or rapidly changed to a seizure, and I crashed the bike and ended up, bloody on the face.
After that, Scott stayed off his bike and in the house. At first, medications did work.
He put me on it, and poof, the seizures stopped.
But the meds stopped working. Brain surgery was an option, but it's invasive with a long recovery. So instead, Scott and his doctor chose laser surgery. During the procedure, his doctor used a tiny catheter to zap lesions thought to cause the seizures and leave healthy tissue intact.
The actual ablation, again, is only about 3-4 minutes total.
Dr. Wu recently co-led a study designed to pinpoint the precise ablation spot in the brain to significantly reduce seizures. In the OR, he uses MRI guidance to insert the probe.
Then it's just activating the probe to create the ablation, and that's done in the control room of the MRI scanner.
Dr. Wu and his colleagues studied the MRI scans of 234 patients in the study and found when they
New at 6, more than 50.
So basically, that's another use for the laser for very precise, very exact surgical procedures. Again, if we think about lasers, whether it's a thermal laser, whether it's a non-thermal laser, the principle behind it is the same. It's still columnated monochromatic unidirectional light in phasing frequency. As you've seen from those two videos, the differencing is the target. So other lasers that are actually quite commonly used in the ablative process, we're going to have a look at now. And this again is a doctor talking about using these again in urology.
One of the new technologies that, or relatively new technologies that we've been using in the treatment of brain tumors is laser ablation. We are basically killing the tumors with heat rather than taking them out. So what we do is we place a laser fiber directly into the center of the tumor, and then using our intraoperative MRI, we fire the laser and watch the heat as it's generated in the brain in real time. And what it allows us to do is to very finely control the amount of tumor kill that we can achieve with the laser. Traditionally speaking, if you're taking out a brain tumor, it requires a large skin incision. You have to go to the ICU after your surgery. Typically, patients are in the hospital for about 4 days. With laser ablation, now you're talking about a much smaller incision, about 0.5 centimeter or about 1/4 of an inch. And now patients are able to go home overnight.
So basically, these lasers are very special and very clever insofar as the actual fiber optic is placed inside the body and the laser light is passed down that. When the laser light exits that fiber optic, it's exactly the same light as any other laser, except again, it's got that target. So other things that are used with lasers would be photo disruption, and photo disruption is used really by creating microplasma within, let's say, an eye in order to be able to remove the lens, which is what we're going to see going on next. If I can.
Versus laser ablation. We're basically.
So here we go. So I know I shouldn't be advertising, but I couldn't.
The LensX laser system uses tightly focused laser pulses to separate tissue and create incisions through a process called photodisruption. Photodisruption is the fragmenting of tissue using light energy. It is called a femtosecond laser because each pulse only lasts a few hundred femtoseconds. A femtosecond is equal to 10 to the -15th second, or 1/millionth of 1 billionth of a second. A femtosecond laser works by focusing a beam no wider than a few microns into the tissue. The laser energy disrupts chemical bonds and generates plasma within the tissue. The plasma gas quickly expands and displaces the surrounding tissue. As the plasma dissipates, it leaves a cavitation bubble. A femtosecond laser incision is produced by performing thousands of laser pulses every second. This produces continuous, tightly controlled tissue separation. By adjusting the depth, size, and location of each pulse as it fires, the LensX laser can create a wide range of cuts on multiple types of tissue.
One of the new technologies that are relatively new tech.
So as you can see there, very broad applications for this technology. It can be used in lots of medical settings. So both thermal and non-thermal lasers really play an important role in medical care. And I think it's safe to say with non-thermal low-level laser especially, my experience of that is we've only just touched the surface of what this can do. I would use these lasers before surgery, during surgery, after surgery for healing, etc. So a lot of things can be done with these. So with non-thermal low-level lasers, there's no heat generated, and basically the effect on the body is a photochemical response, and that response happens within the immune system and other systems within the body, and they don't cause any damage or side effects. The lasers that I've shown you here, there is an argument they cause damage, they cause side effects, but I think sometimes we have to look at the end justifying the means in relation to that. So thermal lasers can be used on most areas of the body. They will generate heat. A lot of the lasers that I've shown you there would be used in an anesthetical situation where the patient is asleep or the patient is sedated and anesthetized their eye, for example, so that they can actually get the result that they want. So each of these lasers has its place. So I wouldn't at this stage start saying that one is better than the other. So what about light emitting diodes? Light emitting diodes are interesting, and there is a lot of lasers out there that aren't lasers, they're actually light emitting diodes. Light emitting diodes work in a very, very different way. So if we go back to the basics, as I keep saying, laser is non-thermal, low level is what I'm talking about. And it's exactly the same as thermal laser insofar as it's columnated, unidirectional, monochromatic, in phase, in frequency. And when you have something like that, you're taking a laser beam and you're taking that beam through the body. So when we use the thermal lasers, we're taking a cannula or something inside the body, we're placing the fiber optic down that and bringing it to where we need it in order to have the effect that we need. We spoke last week about non-thermal low-level laser being more of electromagnetic energy transfer within the body. So we use the laser to deliver that electromagnetic energy to the body, and the body then uses that energy similar to food in order to fuel processes. LEDs are basically quite different. You have a positive P and a negative N plate, and these plates have holes in and they come together. And the significant difference between, I suppose, that light and laser light is the working principles of it. So light emitting diodes basically produce lights as a combination of recombining of positive and negative electrons within that semiconductor, and these are expressed out through holes. And each one of these light particles is just a single photon. So let's have a look at the video on that, and it'll make a little bit more sense than I can.
In simple terms, here's how an LED works. An LED is a basic semiconductor device. P-type semiconductor material containing positively charged carriers called holes is combined with N-type semiconductor material containing negatively charged carriers called electrons to create a diode. When a current supply is connected to the diode, the negative charged electrons are forced to move one direction, and the positive holes move in the opposite direction. When a free electron comes near a hole, it combines with a hole. The holes exist at a lower energy level than the free electron, so the electron must lose energy to combine with the hole. This energy is released in the form of a photon, or a unit of light. The amount of photon energy released determines the frequency or color of the light. The type of material and process of creating the N-type and P-type materials dictate the color of the photons, as well as the efficiency and other performance characteristics of the LED. After processing the material into an LED chip, the chip is installed in a package that allows electrical connection and directs as much light as possible in the desired direction.
So basically, that is the main difference and how it actually works. So let's see if we can make it stop. We can. So the difference with this light is it isn't controlled. So if you think of the laser light, because it's columnated and moving in one direction, all of the light particles in that sequence are going to move in that direction. When we have an LED, that light expressed and forced out through those holes is scattered. So most of you at the moment are sitting in rooms with lights on. That light is scattered light. It's not going in a single direction. And a lot of the confusion comes in terms of, you will see an LED and it will tell you the light properties of that in terms of nanometers, the same as a laser will. But the main difference is, if you're looking at purchasing a laser, the first thing you need to find out is it unidirectional, monochromatic, columnated, in wave, in frequency? If it is, it's a true laser. You need to see that written down. So LEDs usually emit a small band wavelengths, probably about the width of 20 nanometers, and it can't come down to really single specified wavelengths that you can do with a laser, which you can get down to a nanometer wide, which is quite small. Here we go again, let's stop it. So LEDs produce neither columnated nor coherent beams, so they're less ideal when it comes to treating deeper tissues. Okay for surface stuff, as we will see in a moment. So when trying to target deeper tissues, wavelength is very much a critical thing, because we need to get that energy in there. And that wavelength, remember, is pure energy. Once you create energy, you can't destroy it. It eventually dissipates into the energetic universe. So it will actually keep going through. The light itself will be absorbed. So where do we use LEDs? They're pretty much used in aesthetic dermatology, for phototherapy, for the treatment of things like acne, wound healing, psoriasis, skin conditions. They're also used for skin rejuvenation after chemical application processes. Used in biohacking. So biohacking is interesting insofar as we all like to get the best from our body, and the whole principle around biohacking is tapping into the potential that we have using external means. So a lot of biohacking would use LED cabinets, LED lights and stuff like that to try and maximize human potential. So physiotherapy has pretty much used LEDs for a very, very, very long time. It's used in all of the areas where non-thermal low-level laser was used. pretty much, and now it's slowly being replaced by LED by non-thermal low-level lasers as the technology becomes more understood. Because for a long time, the whole thing with low-level lasers was we didn't understand the precise mechanisms of action. We still don't understand all of them, but then when it comes to drugs, we don't understand all of those mechanisms of action either. So again, references will appear at the bottom. You're quite welcome to go chase those up when you get the presentation. So when we look at all of this non-ionizing, non-thermal treatment called photobiomodulation, we really have to look at it in terms of once as we use the right clinical dose in the right context, the treatment can be used to do lots of things. It can be used to alleviate pain and inflammation while stimulating tissue healing and regeneration. So last week when we spoke about aging, we spoke about stimulating tissue, we spoke about healing, and we spoke about regeneration, because as we age, we lose a lot of mitochondrial DNA process, and because of that, we lose energy. From the research I presented you last week, you can see that there's a lot of research out there that says non-thermal low-level lasers restore that energy. So these devices are very good at restoring energy. When our body has energy, once we use our clinical skills, we can direct that energy into any of the directions that we want to take it. So I think over the last, I suppose, really 10 years, there's been huge leaps in terms of the understanding of light and its biological interactions within the body itself, especially how it works within skin, within vision, within nerves, within pretty much every part of our body. So in contrast to, I suppose, the processes that we spoke about, the use of low-dose biotreatments to alleviate pain and inflammation to promote tissue healing and regeneration has always been termed, or has been termed, photobiomodulation. And I suppose it's the universally accepted term, and it's been there for quite some time. But previously, I suppose low-level laser was the term that was used, or cold laser was the term that was used. And I think in order to put everything together, that's why we started talking about photobiomodulation. But drawing back on the lecture we had, the last lecture I gave about this, we talked about electromagnetic energy transfer. And this very much is where the difference lies in terms of these non-thermal low-level lasers. So I think if you think about non-thermal low-level laser, I think the easiest way for me to explain it to you, it's like having an injection of light without the needle. So as we said last week, that laser beam, let's say 635, 405 nanometers, that beam will pass through the body, carrying the photonic energy with it. So looking at conclusions about all of this so far, these are the areas where I suppose accepted use of non-thermal low-level lasers has been put into place. So when I say that, I'm not just talking about what Erchonia is doing, I'm talking about true non-thermal lasers across the spectrum of true non-thermal low-level lasers. So as you can see from there, lots of things from Parkinson's, Alzheimer's, multiple sclerosis, stroke, TBI, hair regrowth. Didn't try that one yet, but when you look at it, you move down there, kidney failure, you move down to arthritis, nail care, you move to fractures and wound healing, all the way basically to muscular degeneration, diabetic retinal neuropathy. All of these areas where we can use these non-thermal low-level lasers. And all of this is done through light, which is activated by the body, because that's the process. So like I said to you last week, is it possible that the body has everything it needs for a happy, healthy life? All we basically need is the, I suppose, the inspiration for that to happen. So this is just a demonstration of using the lasers. This is me and my lovely assistant, Jody. The reason I've got this on is I can't do live demonstrations from here at the moment because we don't have any power. So I was running around today to have a look to see if we could find something. So just have a look at this. I have a strange way of working. I don't take things too seriously. So have a look at this and see what we're doing to poor Jody. Okay. This is an Erchonia training video using the PL Touch, and shortly we're going to use the EVRL. And the first video that we're going to do is neck pain. I'm Rob Sullivan. This is my lovely assistant, and at the moment we have the laser set up on his neck back because we're going to do a neck pain demonstration. The setting I'm using is dermatome. Whenever we treat a patient, just to make things more simple for you, we have 3 rules. The first rule is we treat the dermatome first. The second rule is we always have movement. And the third rule that I like to use is we go to the area of the pain. So in terms of this, the movements are quite specific. So I'm going to get this young man to watch me, and he's going to do what I do. So the first thing he's going to do is gently move slowly to one side, and then he's going to slowly come back to the other side. And then he's going to go to the middle, and he's going to look over his shoulder as far around as he can. Then he's going to go the other way as far as he can. And then we're going to continue those movements. Also, sometimes with the neck, shoulders are going to be involved. So we're going to roll shoulders back and front. That's roughly the protocol for that when we're treating neck pain. I'm using a stand because I'm here on my own today, but normally you don't need to use the stand. So we've done the movement, we've done the dermatome. Now we would switch the machine over to the universal program, and we would go to the areas where the discomfort is. So we will go to, in this instance, the traps, and we're just slowly lasering in a painting motion. Can I get you to rotate your shoulders, please? Nice and slow, and the other way. And that is basically the extent of the treatment. The whole thing is going to last for about 10 minutes. So if we would do the same thing with the EVRL, you don't have a stand for it. So dermatome again. We're going to go up and down. We're going to get you to make the same movements looking from side to side as you did, but nice and slow. And then we're going to get you to stretch it like we did the last time, where you're lying your head towards one side and then the other. And then we're going to rotate the shoulders. Then we would quickly switch the machine over to the universal setting, and we would follow the muscle groups that are involved in this. And would you rotate your shoulders, please? And that's fine. And also when you're doing this, you can also add in the vagus nerve, because remember, the vagus nerve is profoundly anti-inflammatory. So do the other side of the camera, and just following it down. And that's a neck treatment in a nutshell. Okay. This is, so as you can see from that, it's relatively easy to use. I think the whole thing with these particular non-thermal low-level lasers is you need to think outside of the box. I'm going to present you a couple of case studies of some of my patients, and let's work through the presentation. This is a very interesting one. This is a 52-year-old lady, complex regional pain syndrome, going on for quite some time. So the presentation that she had was a history of 12 years. She had been medicated with tricyclics and other pain medicines, other, I suppose, antidepressants that we use for muscle relaxant, etc. She tried all of the available treatments, and it was affecting her left hand. she was tired and she was irritated, and that's putting it mildly. But then again, I suppose if you had complex regional pain syndrome, which creates extreme sensitivity and pain, and it can pretty much affect anywhere in the body, then you'd probably be a little bit tired and irritated as well. It can occur pretty much for no reason, and historically, it can be very, very difficult and challenging to treat. So what we would normally do in these treatments is what I did with Jody there, which is you have that treatment rationale, which is based on the dermatomes. So your set-based protocol really would be dermatome specific, as we had already said. It would be movement driven, as I demonstrated, and it would be area of discomfort, again, as you saw from the demonstration there. So when we evaluate the patient, what we do is we noticed that there was visual changes to the left hand and arm. The skin, appeared thin. There was lack of muscle bulk, so muscle tone, muscle bulk. Her nails, interestingly, were brittle. She didn't have good coordination, and she had involuntary movements from time to time. When I asked her a VAS on a scale of 1 to 10, she was quite vocal in telling me what it was, and it wasn't 10 plus as she put it. It was considerably higher than that, and we won't repeat it. So differential diagnosis, what else could it be? There are your differentials down there on the right hand side of the screen. So we ruled those out. So basically, if you think complex regional pain syndrome is a condition that really has multi-system involvement, it's not just the muscle, it's not just the skin, it's not just the nerve, it's not just the bone, it's a collection of everything. So you need pretty much with that a very strong multi-system approach. So the approach that we use here and the approach that I teach quite widely is a direct brain-based approach. So again, we're using a more sophisticated technology. We're using a red-violet laser, so we're using the EVRL as you saw me using there, ideally, but I think at the time it wasn't available. So we used a standalone laser, and the standalone laser that we used at that time was the FX635. So this is slightly different to the 3-base protocol I gave you, again, because this is response driven. You could argue that response driven is movement driven. So the treatment, basically, when you think about complex regional pain syndrome and you think of her presentation, her irritation, etc., we're going to treat specifically the areas of the brain that create or are responsible for that particular type of function. But an interesting thing that I'd like you to consider is I can teach you about nociceptive pain, I can teach you about visceral pain, I can teach you about all the different labels we put on pain. Your body doesn't know anything about that. All your body knows is this is sore, this hurts, this is really not nice. All the laser knows is, oh, I'm a device that delivers energy. What we're trying to do is create symbiosis between the body and that energy. So basically, that's the treatment methodology. When I said patient response driven, what that means is we would get the patient before we do any treatment to tell us maybe a nursery rhyme. Something like Mary had a little lamb, his fleece as white as snow. We get her to say that 2 or 3 times. We'd be looking at her respiration while she's doing it, facial expression, gestures or movement that she may have or not. And then we would put the laser directly on the brain to the areas relevant to what we're treating. So in a situation like this, it's very difficult to quantify the number of treatments that we would need. Normally, it can be as few as 1, as many as 8. I have a set treatment routine here where we will do 8. If the patient needs to go out of treatment before that because they've recovered, then we would actually take them out of treatment. So this client had 3 treatments in 3 weeks and had 4 maintenance sessions at 6 weekly intervals. She has now been pain-free and medication-free for 18 months. This is an old presentation, so she's been free for quite a bit longer than that. So this was her hand when we started. I draw your attention pretty much to the vein structure there, and basically to the joint alignments and the joint structures. And now let's have a look at that, because I have had arguments with people that that's not the same hand. It is the same hand. Look at the vein structures, look at the little finger, look at the thumb. So that's the difference that she has had from that treatment. So we have to think about possibilities of laser. What possibilities are there? You know, the world is flat, isn't it? Well, we thought it was for a long time. What if it's not flat? Let's go find out. What happened in those days? People were afraid. They were afraid that it wasn't flat, or it was flat, and that they would fall off the edge. But some crackpot in a boat decided he'd go and he'd have a look. What if our bodies, like I said, contained everything we need for a happy, healthy life? What if they don't? Let's go find out. I'm afraid, what if they do contain everything we need? Some crackpot will go and take a look. Maybe we should join the crackpots. So what makes things go wrong within the body? A lot of the time what happens is we get reactions within cells. We get oxidative stress. We get imbalance of free radicals and antioxidants within the body itself. And these pretty much lead to all of the nasty things that we see, the cell damage, the tissue damage. Oxidative stress really is a naturally occurring product of life itself, and it plays a role pretty much in all of our aging process through mitochondrial action. And that's very, very important, because when we spoke last week, we spoke about these lasers, and basically their action is through a mitochondrial process. So the light is absorbed by cytochrome C within the mitochondria. Again, the references for this are coming up there. So there's a large body of scientific evidence now that basically suggests that the long-term, I suppose, stress caused by this oxidation contributes to the development of large amounts of conditions, pretty much everything: cancer, diabetes, heart disease, etc. So what causes oxidative stress? Life causes oxidative stress. A bad diet, lifestyle, certain conditions, poor sleep, for example, environmental factors will cause it. It's something that we can't really escape. So the body's natural immune response also triggers this oxidative stress. So this causes inflammation. That goes after the immune system to fight off infection and to help repair in terms of injury and disease. But what basically happens is we get too much of one of these products that should balance the other products. So what we're talking about here is reactive oxygen species, H2O2, free nitric oxide. All of these things independently, they're terrible. Together, they can be awful. But when we balance them out like these lasers do, then we begin to flush them out of the system. So when a laser, a non-thermal low-level laser, targets the cell, what it's basically doing, it's creating that free nitric oxide, that reactive oxygen species, that H2O2. And what happens within oxygen, within this oxidative stress, is one of those components will be more. But the most important thing we need is that H2O2 to flush it out. So when the laser comes in, it will produce more of that. And that's why they become effective in a lot of strange conditions that we wouldn't really expect. So really, it's about balance. So when you look at the lasers, basically you've got an uneven number of electrons on free radicals. You allow them to easily combine, and basically when they combine with other molecules, we see change. And that's what we were talking about a moment ago when we spoke about reactive oxygen species, when we spoke about H2O2, free nitric oxide, and basically singlet oxygen. You can talk about this all day. And you can go into all of the chemical processes, but really from our point of view, it's not really necessary, because what we're interested in is how will this affect my practice? How can I use this in my practice? I've shown you how I use it in mine, and now we're talking about how we can use it to reduce the very thing that causes all of these things themselves. So when you hold a laser in your hand, you're not just holding a laser. You're holding a device that supplies light to the system. That light within the system is absorbable by cytochrome C and turned into energy for the body and food. Once the body has that energy and that food, anything is possible. So conditions linked to oxidative stress, you have them all there. There are other things that bring the, I suppose, event into the system in the first place, but oxidative stress is the thing that causes the problem. So again, it will also be the same for neurological diseases and conditions, and there are a bucket load of references for this, which you can all enjoy looking up when I've sufficiently bored you tomorrow. So non-thermal low-level lasers, where are they used? They're used in diabetes, they're used in HIV, they're used in liver damage, they're used in asthma, COPD, cardiovascular disease and cancer, so all of the complicated stuff. And then they get used also in all of the interesting stuff like aging, rheumatoid arthritis, blood pressure issues, stroke, male infertility, female infertility, chronic fatigue syndrome, neurological diseases, as we've already mentioned, and basically anything in the body that needs energy to repair. This is where these non-thermal low-level lasers can actually be used. So let's take a breath and think about the research to support what I'm saying, because if I'm telling you something, I need the research to back it up. If I'm going to give you research, I'm not going to give you Erchonia's research, because I've done quite a bit of that research. My colleagues have done quite a bit of that research. I'm more interested in what the other people say out there about this technology. So this was the study that looked at the effects of low-level laser therapy on blood glucose levels within patients with type 1 diabetes. And basically, if you think about diabetes, what is it? It's a widespread, serious public health problem worldwide. And we can't fix it. We can manage it, but it's a growing problem. Treatment really is specific in terms of what we do to the body. We would give the body insulin or supplementation in order for the body to work properly. But what happened with this non-thermal low-level lasers were these lasers were used pretty much on the body generally. And when we worked through the study, the effects were quite high. So another area where these lasers have been used to great effect was low-level laser therapy on HIV-infected patients. One of the problems with HIV is we end up getting severe oxidative stress, and that creates an increased viral load. And when we get an increased viral load, the body can't cope with that load. So when we basically introduce these non-thermal low-level lasers into that, we can help to flush out that oxidative stress and reduce that viral loading by increasing the amount of H2O2 within the system to have that flushing effect within that oxidative stress. So basically what that does is that basically allows the cells that have changed to return. It allows the T cells, the B cells to basically allow themselves to migrate and maturate properly as a result of that. And again, the wavelength used here was 660. So 660 nanometers, now they're using 635, they're using 600, they're using 710. So another area, lung disease. I think lung disease is something which is, it will affect probably, I think it is 25 in 100 people in the course of their lifetime. So that's quite high. So when you think of lung disease, most people think of the nasty things like cancer, etc., etc. We're talking about asthma, we're talking about COPD, we're talking about other lung affected conditions. Again, These conditions are going to create oxidative stress. They create panic within the system. As we saw from the research last week, we can use the laser to basically reduce that stress. So this is a recent study where the low-level laser was used in autism spectrum disorder in children and adolescents aged between 5 and 17 years. There were 40 participants in the study, and each of those received 8 5-minute procedures, which were administered to the base of the skull and the temporal areas across a 4-week period. And basically, if you read through the study tomorrow when you get a chance, you'll see that the positive changes were maintained over time in these particular individuals. So really, it's a case of the laser allows the body to go into rejuvenation and regeneration. And basically, there is a very big response within immune function within the body as a result of these lasers. So when you think about that, you have something that can basically not only affect but help to control structures and biological systems within the body. The immune system is important insofar as it protects us from disease by identifying and destroying pathogens. When we use the laser to create the energy, to create the signaling within the system, then we're enabling the body to do that. So it's very effective in terms of our immune system will detect lots of things. It will detect viruses, it will detect parasitic worms, it will detect loads and loads of things going on within the body, and it distinguishes our cells from cells that aren't healthy and tissues that aren't healthy. So when we employ a laser to that situation, we're giving the body the energy to do that more. So I don't want to run through too many of these scientific case studies. This one is basically talking about Hashimoto's disease, which is a thyroid disease. I will leave you guys to read through that when you get this and have a look at the research, or maybe throw a question up in terms of that, because otherwise we're probably going to go on a lot longer than we need to. So these are just some of the symptoms of that condition. So what I want to do is, we spoke there about boosting the immunity. And this little video is something, again, that I did with poor Jody. Jody is the healthiest man now on the face of the planet. He used to be 117 stone. He couldn't walk straight to save his life. And we've hit him so much with lasers these days now that he's even gone out and got a tattoo. So anyway, let's have a look at Jody and some immune boosting. One of the things that we all tend to miss with laser is their potential for well-being, health, and body maintenance. What we know about non-thermal low-level lasers and electromagnetic energy transfer is that it upregulates our system. It gets all of our cells working the way that they used to. It even gets us producing stem cells. It's great for raising the immune response and treating the seasonal nasties. So basically what I've got is the PL set up here. Don't worry about settings, just get the energy in. So if you look, we have one of the heads completely traversing the spine, so we're pretty much getting every nerve in the body. And we have the other one traversing the CT area of the body, which is helping basically with organs and everything else. Think of what's going on. This is electron transport. This is basically whole body treatment. You can do this without the stand, or if you want to, you can do it with your EVRL. And basically with your EVRL about a foot away from the body, in imperial terms, 30 centimeters otherwise. And basically you're just slowly scanning the body. Now, as you can see from this, this is a treatment that can be done with the patient lying down, or they could be sitting up. So this is general body maintenance. This is aches and pains. This is immune building. This is just basically using your laser to return your body to a comfort level and age that it used to be.
Could you do this with any of the Erchonia lasers, Rob?
You can do it with any of the Erchonia lasers. Personally, I prefer in my clinic, I use either the Zerona or I use the FX, simply because we set patients up on this and we just walk away, leave it run for 15, 20 minutes. They'll have a snooze, we turn the lights off. It's all about the experience of the patient.
Okay, Virtue as well?
As well, Virtue is excellent. I mean, remember with Virtue, it's green, it's slightly more energetic. So yeah, you're gonna, any of the lasers that we have are gonna bring up that immune response. They're gonna return our body to a better balance. Because remember, this is anti-aging to cells. This is stopping that excessive turnover of cells. It's allowing us to balance our systems back to more normal. So moving swiftly on. So non-thermal low-level lasers have been in clinical use now for over 55 years. In all of that time, there's been no recorded side effects. I don't know of any drug out there that can actually say that. When we look at non-thermal low-level lasers, all it is a delivery system for photonic energy that the body can use via the mitochondria and cytochrome C to basically make its chemistry work. So you're putting something in there which is really the first law of medicine, do no harm. You're just giving the body the energy that it needs. And like I said at the beginning, is it possible that our bodies contain everything we need for a happy, healthy life? Are we the drug? Or, you know, if we're the drug, then all that's missing within us is the energy to access that drug, the energy to make it function. So non-thermal low-level laser could possibly be the missing link in the chain of modern restorative medicine and general practice. All we have to do is start using them. So remember in all of this that basically laser is an anagram for light amplification by stimulated emissions of radiation. In my clinics, we like to think because of these devices, the future is bright. And really, as I said in the beginning, perhaps we are looking at the future of medicine. That's my presentation for today. I haven't looked yet to see if there are any questions there. So if there are, Simon or Julie, you might let me know. And I'll answer any questions that you have at this time.
Okay, thanks, Dr. Rob. As usual, an invigorating webinar. We hope everybody got as much out of it as what I did. Currently, there doesn't appear to be any questions. While it's on my mind, though, I just want to make sure, bring to everyone's attention that the third part in your series of the underpinning of non-thermal lasers is Thursday, the 25th of February, 6:30 UK time, 7:30 Central Europe. You'll actually find the invite on our website, but I'm sure Julie has probably sent you an invite or will send you an invite pretty soon anyway. So that's part 3. So please put any questions down there now if you have any, or if you prefer to get off and have your dinner, by all means, email Julie, who sent you the invite for the webinar, and Julie will deflect your questions across to Dr. Rob, and he can answer them and get back to you. So I'll give it another few seconds just to see if any questions appear.
I think for me today was not as fun as I would like it to have been, because I'm sitting here with a halo and normally I have the camera on, and for me the whole thing with this is my hands are everywhere. You missed the best bit, you missed the animation, you just got the slides.
So Rob, while we're waiting for that, you've had various lasers in your clinic since 2012. What sort of effect would you say it's actually had on your practice?
Well, I suppose for us, we took the lasers in the middle of a recession. I was in a situation where, like, I have a reasonably big clinic. We service 32,500 patients a year on behalf of the Irish health authorities and also privately. And we were at the stage where, I suppose in plain English, we were shagged. You know, money had stopped coming in. We were struggling to make ends meet. I was looking to possibly have to lay off staff. At that stage, I'd already done some research work with you guys, really deceitful research, because I was trying to prove that this technology was a total load of crap and couldn't possibly work, and ended up proving that no, it's not a load of crap, and yes, it does work. So I think we brought the lasers into clinic, and within, I suppose, what, 6 weeks, our cash flow problems were pretty much over. Within 6 months, we were having to bring in more staff because we didn't have enough people to treat them. So I think for me, it pretty much saved our clinic. It saved jobs. It saved families from going on the dole. So for us, it was very, very important. And like the same has been true for us during COVID, because we've developed a reputation for treating pain. We've developed a reputation for treating prediabetes, diabetes, and obesity. And as a result of that, we're considered to be an essential service, not just because we do surgery, but because of the other things that we do. So I think from my point of view, these lasers have made us, you know, touching wood, they've made us recession proof, and they've made us able to survive this current nasty. So for me, I just don't understand why everybody like us, all of my clinicians, have a laser. I don't understand why every GP, every chiropractor, every nurse, every doctor on the planet doesn't have one in their pocket. But then again, you know, Johnson & Johnson wouldn't be happy, and Pfizer wouldn't be making vaccines.
Yeah, that's true enough. I mean, that's always something that we've advocated. It's easier said than done, but in these sort of times, trying to push forward, because I don't think you don't do as many surgeries as you used to do as well, do you?
No, you wrecked my surgical career, Mr. Ramshaw. I mean, I had gone from, you know, my thing was, if I can't fix it with a knife or stick a needle in it, I wasn't happy. You know, I was doing 450 joint replacement surgeries and various other surgeries a year. And before COVID hit, I had gone down to maybe 80 surgeries a year. I was just doing enough hours to keep my skills. Okay, with COVID, I've probably done a bit more surgery because people have had the time to get things fixed. But I mean, for me, I found, look, I'd go take somebody's knee out and we'd go to replace it. And, you know, we'd flip it over and we'd look at the grand piano bit and the other bit and we'd think, hang on a second, why did I take this out? The X-ray said I needed to, the CT, MRI said I needed to, but in reality, I didn't. It was perfectly good. The pain they had was not consistent with what I'd just done. So we started then looking at, I suppose, my chiropractor upstairs was always nibbling in my ear, talking about periarticular tissues, and I was always thinking, oh, periarticular drawstrings. And basically, we then started using the lasers on periarticular tissue. And what basically happened was people didn't need joint replacements. They didn't need hip replacements. They didn't need ankle and toe replacements. What they basically needed was the body to have enough energy to go into that repair cycle, because like we have everything in us we need to repair ourselves. What we don't have is the energy to do that. And like we said in the lecture the other week, you know, Madawa had it right. You know, the minute we hit that reproductive cycle, our bodies scientifically, I suppose, perpetuation of the species wise, they've done everything they need to do. So now we go into decline and we lose that somic energy. I now have a device and another one over there that puts that somic energy back. You know, I don't need to do the surgery.
It sounds so simple when you put it like that. And I think, you know, this is going to be the mainstay of our growth in Europe and the Middle East. You know, Erchonia in North America alone have around 16,000 true lasers out in the field. But it's just to try to keep up with the education and knowledge. So if a clinic would like to add something to their portfolio, that they can do it based on factual evidence rather than, I suppose we've all had it in various companies where, you know, you get taken in by a good sales rep who comes across very well. And at Erchonia, we like to do it by way of, you know, level 1, 510K, placebo-controlled, double-blind, randomized research. And holding 18 out of the 21 US FDA approvals for low-level laser. We'll keep on banging that drum. We have over $5 million invested at any one time in new research. So we're never going to be the type of company that rests on our laurels, and we'll always keep driving it forward. And again, with help from the likes of yourself and, you know, a lot of our other doctors and practitioners who use the lasers. So, Dr. Rob, appreciate you coming on and your time as always. Very much looking forward to part 3.
Just one thing, I have about 3 minutes of battery life left, but you know, if you're listening to me and you're sitting there and you're thinking, you know, should I, shouldn't I, in terms of these lasers? I mean, I cannot run my business without this technology. I am probably one of the most hated practitioners in the hospitals where I work because I use considerably less drugs than anybody else does, and I pretty much have no infections when I do surgery. And all of that is down to the fact of having a device that empowers the body. I don't have a laser that basically, you know, the Jedi have that cuts pieces off. I have a laser that empowers the body. And if you're thinking in terms of what's the next step for your clinic, the next step for your clinic is empowerment. You know, you guys empowered me to do what I do. And, you know, I'm just saying, for me, it's a no-brainer. Like, if you want to up the ante, if you want to get better results, if you want to basically laugh with your patients, cry with your patients, then, you know, just give them a bit of energy. You know, it comes out of a little yoke like this. It's great stuff. My battery is going to go. You'll be delighted to know.
No, well, thanks for that. We try to put everything across, obviously, in an unbiased way. We like people to look at the research and the education that we deliver, and as you said at the start of the presentation, make their own mind up as to how they want to do things. One quick question, Rob, if your laptop lasts that long, how do you know how to set the EVRL up to work on different issues? I think Dr. Rob's battery's actually gone there. That question's come in from Andrea. We provide with the laser, we have around 8 different treatment settings where we program specific hertz into whichever treatment. That could be generic pain, acute pain, chronic pain, the brain, dermatome, pre-op, post-op. So it depends what you're actually going to treat. I would say the different outputs, the different hertz settings are responsible maybe for another 5 to 10% of efficacy that you'll get from your laser. I think the actual wavelengths of the laser and how we set it up by way of the line coherent beam will be pretty much what you need anyway. But on our YouTube channel, we have a range of training videos. And I know with a lot of our customers, we set up personal WhatsApp groups, which I must have around 300 in total, because we like to give hands-on help wherever we possibly can. So Dr. Rob and some of our other clinicians frequently send on videos if there's any specific condition you're wanting to treat. However, most of it will be on our YouTube training channel. Also in the marketing collateral files as well. There's training and education there. So, but yeah, a lot of the time, as Dr. Rob said before, you know, we've progressed how we do our treatments over the years. You know, when we first started, we looked at the area of pain. As time sort of went on, we tailored our approach. So, we looked at the dermatome associated with the pain that you're feeling, treated the dermatome and treated the area of pain. More recent times, we've also gone to treat the brain. or our practitioners have, I should say. Not necessarily just for, you know, any ailments they've come across, any mental health issues or any you know, neuro-related stuff, but just to try to set up that communication cascade where you go from the brain down the nerve route, out the branches to your cells. The systemic effect, which is actually caused by the lasers up and down our body, is responsible for a lot of the quality of results that we get. You know, and there are research to back that up. So in answer to your question, Andrea, you know, I think the next step, because I know that you've actually purchased one of the fat loss lasers, is we will do some online training with the EVRL. We call it the derma laser as well because it has the violet light, so it's antimicrobial. So we treat a lot of dermatological conditions, you know, like your acnes and your eczemas and your rosaceas and things like that. A lot of our medical aesthetic clinics, for example, will use it on any treatments they do which involve pain. So it can reduce the amount of pain the patient feels and accelerate the whole healing process. Some of our surgeons will use it, you know, pre-operation, whether that's a breast augmentation, whether it's liposuction, whether it's a joint replacement. Using it before the operation and post-operation, again, will accelerate that healing process. And of course, anybody who is either in the chiropractic, physiotherapy, osteopath, general pain management sectors, you know, we have a range of training videos for you guys as well. So it's all in the training. Without the training, you wouldn't be able to optimize the performance of the laser. So don't think there's any other questions. Guys, 8:15 UK time. Very much appreciate your time again. Please provide feedback to the webinars. Also provide any suggestions that you may have as to what topics you would like covering in future. And we'll carry on using the expertise that Dr. Rob Sullivan's gained over the last 8 to 9 years. Some of our American colleagues, Dr. Rob Sullivan, Dr. Kurt Gare, Dr. Trevor Berry. There's our own UK-based Dr. Jake Cook, who will be coming on soon, participating in a CPD course. So again, thanks for your time, guys, and we look forward to seeing you on the next one. Thank you.